Big or small, furry or scaly, it doesn't matter. Because just like Dory said in Finding Nemo, just keep swimming, just keep swimming. If there's a bond and there's love, then what does it matter? We all choose who we choose. And today, we're meeting a goldfish called Gonzo. What's up with goldfish? Fancy goldfish are like the pugs of the aquarium world. What do I mean by that? Well, any of you who own a pug know what I'm talking about. Goofy, they see you. They come wiggling their bodies up to you. They like their treats. But when they got problems, boy, do you know that they got problems. Those of you with pugs know it, because I'm there, I'm right with you, right? So fancy goldfish, they're not just decorations. For some people, they're family. And sometimes family gets cancer. And that's what happened to Gonzo the goldfish. So today we went to Gonzo's house to try to figure it out. So when a tumor pops up on a fish, he can injure himself. It's damaging to him, and eventually it's gonna cause problems with the way that he swims, the way that he moves his body. You're going to see goldfish surgery. How do we do it? Well, here's the thing. It's just like how we do it for your dogs and cats. For some of you, I've been in your homes, your living rooms, your kitchen, and I've done surgeries, sedations. It's all the same thing for fish. How do we do it? Well, I take some buckets and I walk up to Gonzo's room. And what do we see? Here's Gonzo's with his tank mates. The first thing I gotta do is figure out, is Gonzo in good shape to do a surgery? Just like I would do for your dog and cat. Gonzo's swimming around and he's a goofball. Look at this fish. He's swimming upside down and doing circles in his tank. You can clearly see the personalities that these fish have. Next thing, I measure out 10 liters of water from his tank, and then I put in MS-222. What is MS-222? It's an anesthetic agent slash sedation. This is no different from when I go to your house and some of your cats greet me and they need some gabapentin because they're the boss and I'm not, and they're gonna eat me if I don't sedate them. Or the dogs that have some fear aggression, and then I give you the little syringe and you squish it in their mouth and they feel much better about the situation. That's what MS-222 is. I mix it in the bucket, but what else do I mix in the bucket? Well, I also mix in the bucket some Arm & Hammer baking soda. And why would I do that? Well, I gotta pH balance the situation. The anesthetic is so acidic, we gotta buffer it down so we don't literally burn the fish. So we mix it all in, we put the goldfish, Gonzo, cup them with our hands. Notice how not stressed they are. We put them right in the bucket, and then what happens from there? Well, then we gotta wait until Gonzo is sedate. Now Gonzo, just like some of your pets that I've seen, ain't a cheap date. Gonzo took a fair amount of drugs to get the intended effect. That was Gonzo's deal. 20 minutes later, and you can see I'm timing it on my trusty 1980s Casio watch, is right there, and we're measuring how is he breathing. And then I reach my hand into his tank and I do the caudal fin test. I give a little pinch. And when he stops moving and wriggling, I know he's ready. The surgery for Gonzo happens out of the water, not in the water. We have a surgical table. Now, how does Gonzo breathe? If for a dog or cat, if you're under anesthetic, commonly, you either have an IV in or you have a tube that's going into your lungs, delivering oxygen and air, which also delivers an anesthetic. For Gonzo, the anesthetic is mixed in the water. So we take syringes and our technician is pushing water through his mouth that goes through his gills that gives him some anesthetic and some oxygen. But he can't go too deep. Just like for your pets, they can't go too deep, they can't be too light. So we often also put in just fresh water and then we balance how he's breathing. So we're doing all that outside of the table. What happens next? It's surgery time. So you can see how I'm removing this tumor right now. And then what happens? On some tumors, you don't know where the tumor ends and the regular body begins. And it's very hard to judge in this area for Gonzo. So what do we do next to try to help him? Cryosurgery. Check this out. I'm literally using ice crystals and I'm placing it into the wounds. And what I'm doing is allowing these ice crystals to percolate and then hopefully kill off some cancer cells. Then what do I gotta do for Gonzo? Well, fish don't have the same amount of blood in them as dogs or cats and people. So hemostasis is really important. If you don't control bleeding, they can bleed out. Obviously not good. So what's the next thing we're gonna do? Hemostasis. How do we do it? electrocautery. So we're gonna put some pressure, and you can see my little machine, and I'm going zap, 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 and I'm just trying to cauterize these wounds. But then here's the most amazing thing for Gonzo. Gonzo needs a Band-Aid. So how do you put on a Band-Aid for a fish? We have a special Band-Aid that you're gonna see me spray on, and then I mix it with antibiotics and I spray it on again. It's like a polymer, right? It's a polymer that we put on. So you can see that polymer going on, fish Band-Aid happening, Gonzo's looking good, we've controlled bleeding. Next, we gotta bring him out of the anesthetic. For any of you who have seen me use injectable anesthetic on your cats or dogs, what do I do when I reverse it? Well, I ask you, what's their nickname? What do you like to call them? And I start calling them that name, and then I pick them up with my hands and I start to walk them and I move their body and I get the circulation going. It's the same thing with the fish. So I start to give them fresh water, and then I take a syringe and I start breathing for them. And then when they show me that they're starting to breathe a little bit more on their own, I take them in my hands and I swim for them in the tank, and back and forth they go. And the funny thing about Gonzo, he's like, okay, guy, like, I know you got me, but I'm still gonna try to control the situation. And so little Gonzo, when I'm swimming for him, if you look at his eyes, he's going, okay, let's go left, let's go right, let's go left, let's go right. He's trying to direct where to go. So we're swimming for Gonzo, and then I let him go. And if he can swim and be sternal, then I know he's okay. Then I make some medicated food for him, some antibiotics. So for your dogs and cats, I'll give tablets, I'll give pills, I'll give long-acting injectables. For Gonzo, we make a custom food that's got an antibiotic right in there, and then we feed him that afterwards. And then we see how he does. So that's goldfish surgery. Big or small, furry or scaly, it doesn't matter. Because just like Dory said in Finding Nemo, just keep swimming, just keep swimming, just keep swimming. No matter what's going on in your life, just keep swimming, just keep swimming. Your pet's got some things that we're helping them work through. Just keep swimming, just keep swimming. I'm gonna keep on swimming too. Until next time.